Hi, I'm Dr. Greg Grillo with Express Dentist, and I'm here to talk a little bit about toothaches. If you're dealing with a toothache, you have my greatest empathy. Tooth pain can be some of the most extreme pain that people deal with, and it can be for various causes. But usually when it's happening, all you want to know is, how do I get rid of this pain? There are a number of different symptoms and different degrees of toothaches. It can be a very sharp shooting pain, or you can have swelling around your teeth. You can have pain when you chew. Sometimes it's a sore pain. Sometimes it's a very sharp shooting pain. You can have sensitivity just to temperature or to sugar. And in some cases, you can have a fever, or you can have bleeding and even a foul taste or bad odor. There are many, many different types of symptoms and a whole spectrum of discomfort levels with a toothache. The most common causes of a toothache, the first of all, is tooth decay, a common cavity. So cavities are caused by bacteria, and when bacteria start to penetrate through the hard outer layer, the enamel of the tooth, and they get down into the tooth, there are many, many nerve endings. So you can start getting sensitivity to temperature or to sweets, for example, and that may indicate that there's a cavity developing. Now, as a cavity gets deeper, it can eventually get into the center of the tooth, and that's where the nerve and the blood supply of the tooth is. And once it gets into the center, that's when it becomes infected, very inflamed, and these are typically the toothaches that really create a lot of misery. And eventually, a toothache can turn into a full-blown abscess, and that's when the bacteria have penetrated down through the tooth into the jawbone, and in the jawbone, you start to get some swelling, and bone doesn't swell very well. So when you start to get a pressure buildup from an infection underneath a tooth, it can cause a significant amount of pain. Now, you can also get pain from an impacted tooth. This is most commonly a wisdom tooth. A wisdom tooth that has not come in completely. It's just underneath the gum line. And sometimes bacteria can get in underneath the gum around the wisdom tooth, and you start to get pain. So if you get pain behind your last tooth, way in the back, and it's sore, even to push with your finger, there's any type of facial swelling in that area, that may be an impacted wisdom tooth that you don't even realize is there. And this can happen at any age in our lives. You can also get abscesses from gum disease or periodontal disease. And this is a little different than cavities, but it's also caused by bacteria. And bacteria will get down into the gums, start to create an infection there. And then the gums themselves will start to swell, and you can get a significant amount of pain as that pressure builds around the gum line. You can also have pain from trauma. So if your tooth is hit with an elbow, for example, or you hit your head in an accident, your teeth come together, it could potentially damage the nerve, and that trauma could lead to an abscess. And if you've had trauma, you definitely want to have that evaluated just as soon as possible as well. Now, there are some other indications or causes of toothaches that we don't think about as often. There is a difference between the site of pain, so in a tooth, and the source of pain, maybe somewhere away from the tooth, but being referred into the tooth. For example, you have some large sinuses up above your upper teeth and below your eyes. The maxillary sinuses are there, and the roots of your upper teeth, some of them go right up near the lining of the sinus. So if you get congestion in your sinuses, it can actually push on your teeth and make your upper teeth sore or sensitive. So sometimes that's the cause of a toothache. You can also get muscular toothaches. So this is where the muscle fibers in the side of your face, they attach into the jawbone, and those fibers, if they become inflamed and sore, they can send pain right through into the jawbone and seemingly into the teeth. And we see many cases where there's actually muscle pain that's causing a toothache. And one way to try to figure this out, if you're not sure, is to put ice on the side of your face on the muscles of your face. And if you feel relief, a significant amount of relief in the teeth, then that can indicate that the pain is actually coming from the muscles and not from the tooth. I see this every week when I'm in the office. And of course, headaches, very similar to muscle aches, but you can have headaches that radiate. You already know that you can have a sore neck and it radiates all the way up into your head. Same thing, all the muscles of the jaw and the neck and the back, they all run together in a sense. They're all part of a similar system. And so you can have a headache that's just radiating down into your face and in your teeth. And again, this is a good time to check those jaw muscles on the side of your face. There's something else called a cardiac toothache, and this is not very common, but it can be very serious if it's occurring. And this is where someone is having a cardiac event, a heart attack of some kind, and they're feeling the pain up in their face. And in most cases, this is up maybe underneath the chin and the neck through both sides of the face. Not usually just on one side, but if it is on one side, it would be most commonly on the left side, since that's the side that the heart is on. So this is something just to be aware of, and is definitely something we want to take very seriously. So toothaches are treated in different ways depending on the severity of the problem. So if you have a tooth decay that's causing pain, if it's just a sensitivity, but it's not throbbing and aching, maybe you're sensitive to sugar, for example, then that may be treated with a filling in most cases, and that will take care of it. If it's a larger cavity, there's more breakdown in the tooth, and you may need to have a cap or a crown put on the tooth. Now, if you have a dental abscess where the cavity or the crack has gotten so bad that it's gotten into the nerve center and you have that throbbing, aching, swollen toothache possibly, then you may need to have the tooth opened up and drained out and a root canal completed. Or in some cases, the tooth may need to be removed completely to solve the problem. An impacted tooth, like a wisdom tooth that we discussed, if it's abscessing, then it may first be treated with antibiotics and warm saltwater rinses, and then plans for removal in most cases so that that doesn't happen again. If you have periodontal disease or gum disease, again, maybe establish drainage ideally, possibly clean out the area around the gums and get some drainage, and then have treatment done to try to get the gum disease under control. In severe cases where there's been a lot of bone loss, you may just lose a tooth, unfortunately. We talked about referred pain from headaches and sinuses and jaw problems. These are areas that we want to treat specifically for that problem and not be trying to treat teeth that aren't really the source of the problem. That can lead us to other problems that you don't need to have. So how do you prevent toothaches? Some of them are unavoidable. If you get cracks in your teeth, from wear and tear or from an accident, that's obviously very unfortunate. But you can definitely cut your risk of toothache significantly by brushing and flossing twice a day. It's very important to do that, and watch your diet. Really limit the acidic type foods and drinks, and especially sugar, raw sugar, fructose, corn syrup. All of those types of sugars are very detrimental to dental health. And of course, have regular checkups so that you catch cavities when they're small, so they don't have a chance to cause significant problem. And try to replace your toothbrush every 3 months. Keep up on that. Avoid smoking so that you help maintain your gum health better. These are all preventive types of things that can really help make sure that you stay healthy and you stay away from a toothache. But if you're experiencing a toothache, really of any kind, you need to see a dentist as soon as you can. If it's just a little bit sensitive or bothered by temperature or sweet food, then it certainly can wait at least until you can get in. But if you're having any kind of swelling, especially into the face, down into the neck, this needs immediate treatment. It's not worth the risk. Dental infections that involve swelling, especially in the lower face and the neck, can become very, very serious and can actually be life-threatening. If you have a fever along with a toothache, that needs to be evaluated as soon as possible. So you really don't want to wait too long if you have a toothache. And the more severe it is, or if there's pain, if there's swelling involved, you want that evaluated just as quickly as you possibly can. If you are waiting to get into your dentist appointment or to get a visit of some kind, headed to the ER in the worst cases, you can use over-the-counter painkillers like Tylenol and ibuprofen if they're indicated for you. Sometimes you can use like an Oragel that you rub on the gums. It can help a little bit, depends on the severity. And then salt water rinses if there's any kind of swelling or soreness in the gum. And obviously avoid chewing on the affected tooth because that just irritates everything. The bottom line is, if you have symptoms in your mouth, pain, it's telling you something and it needs to be evaluated to see why. And hopefully it's a simple fix, but don't let a toothache become a very serious problem because they can become emergencies. An Express Dentist has a trusted network of providers, general dentists and specialists, and we can help you get in touch with someone just as quickly as possible so that you can get the help that you need and deserve. Again, I'm Dr. Greg Grillo with Express Dentist, and let us know if we can help.